He was one of the first to identify AIDS. Next.
Whichever stereotype you're going to try to put on me isn't going to fit. That's for sure.
Because there's no stopping me.
Ask your healthcare provider if Biktarvy is right for you. And visit Biktarvy.com to view the important facts, including important warnings.
Welcome to Plus Talk on Plus Life. We're all about turning positive into a plus. Can you believe it? It has been 40 years since AIDS appeared. Today on Plus Talk, I'm joined by Dr. Michael Gottlieb. He was one of the first people to discover the virus. Dr. Gottlieb, good to see you, sir.
Thank you, Carl. It's good to be here.
Can you believe it's been 40 years?
No, I can't believe it. It kind of sped by for me. You know, the story of HIV and AIDS has had so many twists and turns, it's gone pretty quickly.
Take me back to that day, 1981, when this sort of came onto your radar.
Well, January 1981, and we saw a first patient at UCLA, and then Dr. Joel Weissman in Sherman Oaks referred a couple of other patients. Then we had 3. Then we snooped around town and found a couple of more. So suddenly we had 5 patients, all with pneumocystis pneumonia, and we made this report to CDC in June of 1981. And
what made it so unusual? Was it that it seemed to be at the time just healthy, otherwise healthy gay men? What set alarm bells off for you?
Well, it was this diagnosis of pneumocystis pneumonia, which is an opportunistic infection that only happens when an immune system is pretty well wiped out. And that's what was so striking about this, that previously healthy gay men all of a sudden were coming in with pneumocystis pneumonia. And it indicated they had underlying immune deficiency.
So what were the next steps? You reported it to the CDC?
Well, called CDC, reported it, got it published, and then we found that these CD4 cells seemed to be the target of whatever it was, but we just didn't know what it was at the time. We didn't know it was a virus.
I don't like to use the term panic, but I mean, when does the panic set in for you? When do you go, my gosh, this is bigger than just a couple of very sort of unusual diagnoses?
Well, there's a lot of worry for sure. Joel Weissman and his associate Gene Rogalski were telling me about lots of other men in their practice who had lesser degrees of illness, who just didn't feel right. And they, of course, were people with HIV who hadn't progressed to an AIDS diagnosis with pneumocystis or some other serious infection. And so when I heard that, I started to worry more. But I don't think anybody could have imagined, what the HIV/AIDS epidemic became worldwide, with tens of millions of people affected. And
would still be affecting people 40 years later.
Exactly.
Yeah, when do we associated it in the early days as sort of a gay white man's disease or an IV drug user's disease. When did you realize that, no, this is actually bigger than that? This is a disease that doesn't discriminate.
Yeah, it was almost from the get-go. When some articles were published in December of 1981, particularly from New York City, it was clear that it was IV drug users and some heterosexual adults as well. And so clearly this was something that could affect anybody.
I know we're talking about 1981, and I guess it's hard to say, but when do you think that these early cases, rather, probably were first infected? How long do you think that incubation period was until 1981 when this started making news?
Well, that's a great question. So they've done retrospective studies on blood samples that have been frozen away since the late 70s. And they're able to look back and see that HIV was in this country in the blood supply at least as early as 1977. So these young men became infected probably around then, between 77 and 80. And they seem to be particularly susceptible to the effects of the virus because they progressed to AIDS with pneumocystis pneumonia very quickly. Now, on average, people progress over 11 years, but these untreated, of course. But these young men progressed over a period of 3 or 4 years. And it's not because the virus was any more virulent; it's just that for some reason they were more susceptible.
Yeah, and I think, all the work you did, and you sort of, over the years, you are definitely an icon in this field, whether it's your involvement with AMFAR to taking care of Rock Hudson. And obviously you can't speak for patient confidentiality, but how does that come about? And And what did Rock Hudson and his diagnosis and ultimately what happened to him, how did that change the way people looked at AIDS and HIV back then?
Well, it's kind of one of those landmark events, where, people who didn't care about what was happening all of a sudden, had someone to focus on, a celebrity, and they suddenly began to care. And also the opinion leaders, so-called influencers in today's terminology, people like Elizabeth Taylor and ultimately the president and Mrs. Reagan, they sort of got on board half-heartedly and at least gave a semi-green light for Congress to start appropriating money to do research and to find treatments for HIV, because one of theirs, Rock Hudson, had it.
Yeah, well, exactly. And when you say one of theirs, for those who don't know, obviously Ronald Reagan was a movie star long before he was the president of the United States. There is still, to this day, a lot of anger pent up towards President Reagan for the fact that he wouldn't say the word AIDS. Just your personal opinion. Why do you think he wouldn't talk about it?
I don't think it was necessarily high up on his list. And, he was trying I'm not an apologist for him by any means, but he was trying to break up the Soviet Union. He wanted, that was his big fish. And I think he had a lot of religious conservatives in his cabinet who just said, don't do anything for those people. Yeah. And I think that was a good deal part of it.
Yeah, well, look, here we are 40 years later. We're in the midst of another pandemic, obviously a very different machine altogether. But do you sit here and go, wow, look, we've got a vaccine in less than a year, but here we are 40 years later and we're still not there yet with HIV/AIDS?
Yeah, but this vaccine for COVID was much easier to do, and it's not for lack of trying to find an HIV vaccine. They've been trying for 40 years, working hard, spent billions, but it's just been a more difficult nut to crack. And the COVID vaccine was an easier thing to do because it's got this big old spike protein sticking out of its surface, so it was a real obvious target. HIV also changed this a lot. It's got a lot of different strains, and it's just a harder vaccine to make. Yeah,
well, you know what? At least, though, we can take what we've learned through COVID and apply it to HIV. And I think, we're aware now that a lot of what we've learned through HIV was applied to COVID. So they've kind of helped each other out.
I agree. I certainly hope so, Carl. But the handling of both of these epidemics or pandemics had been deficient at the highest levels for different reasons. Ronald Reagan, as you pointed out, didn't respond for his set of reasons, and this last president didn't respond properly for his set of reasons. So it really makes a difference who's the president of the United States when it comes to pandemics and supporting public health properly.
Yeah, absolutely. 2019, you teamed up with APLA Health. Why was it time to join forces with them?
Well, I was a little later on in my career. I've been in private practice. APLA offered just great infrastructure, the ability to see my patients and see their patients in a state-of-the-art facility, and to have all sorts of high-tech computer support, and a group of colleagues who are among the best doctors and physician assistants and nurse practitioners that I've ever worked with.
Doctor, where does your passion for serving the HIV community, where does that come from?
Well, it comes from the fact that I really like people. And I really like doing what I do. And I in the early years, the first patients were my contemporaries. I was 33 years old, and these patients were in the 31, 33 age range. And I really identified with them, and I really wanted to help them. And over the years, I'm so glad that there's been improvements in care. My passion comes from the fact that I basically like people, I like their stories, and I like to do what I do, and I can bring my skill set to help them.
And we're glad you do. In the last couple of seconds I've got with you, obviously receiving an HIV diagnosis in any time is still a tough pill to swallow, even though we're in the world of U equals U and antiretrovirals and PrEP and all of that. How do you break the news to a patient these days? How do you let them know so that they hear it and realize it's not the end of the world?
Well, the good news is that I don't have to do it very often.
That's great news.
But if I have to do it because of all the advances in PrEP and U equals U, all of those make it less likely to happen. But if it does happen, just sit quietly with somebody. It's never easy, and just try to reassure people the patient's going to be all right. That we have so much to offer, but it's still a tough one.
It's a chronic, manageable illness if we do it right.
And if you compare it, Carl, to other illnesses, diabetes, high blood pressure, the success story of HIV is people can live a good life with excellent quality of life, and in many cases superior to that of patients with other chronic illnesses.
And the reality is, when people, because you say that to people and they go, "Oh yeah, please diabetes." No, you're speaking the truth. It's a chronic illness just like those, and as you said, kind of easier to control, right?
It is. On the other hand, we don't want to encourage anybody to go out and get it.
No,
but in fact, it's got a good prognosis when caught early and treated properly.
Dr. Gottlieb, thank you so much for your time. Great seeing you again, sir.
Same here. Take care, Carl.
Absolutely. I could talk to that man all afternoon. He's a wealth of knowledge. And can you believe it? 40 years. Unfortunately, though, that's all the time we've got for this episode of Plus Talk. If you want more information about what we've talked about, check out the website, pluslifemedia.com, and be sure to follow us across social media platforms. We are at Plus Life Media. Till next time, stay safe. Bye-bye.